I was all alone there. Next day, they called me again. They said that we are going to do mammogram again. And then the doctor called me that you have breast cancer. I don't know where I parked my car.
You start doubting yourself.
Welcome back to another episode of Disease Free Society, where we decode health without noise. Today is a personal episode, a special one. Today, we are sharing a lived experience. Generally, in this podcast, we talk about clinical lab, reports, medical things, and tips and tricks. But this episode is a special one. As it is rightly said, behind every successful man, there is a woman. Today, I'm joined by a very special person, Mrs. Rekha Sodhi, wife of Dr. Virender Sodhi, in this special podcast. She is here not as a case or a medical story. She is here as a warrior. She fought the toughest battle of her life and came back as a warrior, as a winner, and a changed woman. I am talking about the word breast cancer. She's a breast cancer survivor.
Dr. Sodhi, when illness enters your home, it becomes personal. How were the things at that time?
I see a lot of cancer patients every day, but when it enters your home, you start doubting yourself.
Because you are husband and you are doctor at the same time.
So that was a very tough decision on my part, and so I have to make a very, very strong case for her that yes, we can beat it.
The
Yes,
partner in you was
Exactly.
on the forefront.
Exactly, and we changed a lot, and I think there is a history which we certainly like to discuss as we unfold this story. As a doctor, I see breast cancer patients every day in my clinic, and I see their healing journeys. But when it hit home, when my own wife was diagnosed with breast cancer, I had to think very differently, and so how I can help the whole process. It hit me very hard.
Rekha ma'am, take me back to the time when you were not diagnosed, and how was the life at that time? What were the symptoms that you initially observed in you?
You know, being an immigrant here, so we were like every day we were struggling. We came here with nothing, so we have to prove ourselves. We were working very hard, never listened to our body. I was wearing a multiple cap on my head, being a wife, being a mom, being a living in a joint family. So
And immigrant, at top of it, you were an immigrant. Back in 40 years back, we are talking about.
Yeah. So that was there was a sign, but I never listened to that. So I was so busy in working, taking care of my family, and responsibility for everything, but I was ignoring myself a lot.
So other things were at the forefront, and Rekha as an individual was at the back burner. You were not listening to yourself.
Yeah.
That was the main thing that
Yeah.
you could easily connect.
There was a fatigue, but I normalized it. There was a lot of stress, but I told myself that it's a part of a life, so we have to go through. I have to go through that. We have to keep moving because that's what women do.
I think we all immigrants, Indians, we are brought up that way. You had been mentioning about it quite often, that all the burden is on the woman to carry the household.
Yeah.
Because we are the engine of the family.
Yeah, I think so. That is what we need to prioritize ourselves. Is it, Dr. Sodhi?
Yeah, as a female, she comes the last. Everybody else is more important for her. Her husband have kids, her mother, father, relatives, friends, but she is not taking care of herself. And interestingly, cancer patient does also has a history of giving to others.
They
have
the
a hard time receiving it. So it is very difficult for them to receive the care. So this is another thing which is a kind of a interesting factor about cancer patients.
One request here, audience, this is not a medical advice. It is Rekha ma'am's lived experience. What she had gone through, we are just discussing that. Rekha ma'am, I know it would be tough for you, but can you take us to the day when it was diagnosed, when you first time heard that word?
You know, I went to my primary doctor because my husband cannot be my primary doctor.
Oh.
So I have to go to my primary doctor, and she said that, did you have any symptom? I said, I don't have any symptom because my sister was diagnosed with the breast cancer 5 years ago
before your diagnosis, she was diagnosed.
Yeah,
Okay.
she was diagnosed, and she said that because you had a family history, why don't you go for a mammogram?
Okay.
So I went there, and they said that if everything is okay, then they are not going to call me, and if there is something wrong, then they are going to call me tomorrow.
And it's alone. You are there alone.
I was all alone there because I was pretty confident that nothing is wrong with me because there was no symptom. I didn't find any symptom.
Because
And
fatigue, stress, everything was normal for you.
Everything
That was part
so
of your
normal.
life.
That was so normal for me. And then next day they called me again and they said we have to recheck you. And on that time too, I went all alone because my belief system is that I'm doing everything what I can do. I was doing exercise, I was eating right, and everything is going to be okay for me. So I went there, and then they said that we are going to do mammogram again. So they did that, and then they said that you have to wait for a little bit. And then the doctor called me, and she said that you have breast cancer. And I was all alone. And when she said that the cancer world is so scary too, I said, where is my husband? Where is Dr. Sodhi? And she said that he is with the patient. I said, I am in the hospital. I don't know where I park my car or anywhere, which level I park my car. I was going all around all the levels, but I was not able to find my car. Where I park my car? I don't know where I am. I'm kind of lost there too.
It was a blank vacuum around you when you heard that.
Yeah. It was a very much shocking for me, and I can't believe that I have that.
So when I got a call that Rekha called, and she said, she didn't know where she's parked, and she's trying to find her car, and she could not find her car because she's so confused. I said, stay there, I'm coming right away. And so by the time I was going there, she found her car, I think, and they said, no, I'm coming. I was saying, no, wait, but no, she drove, and she's kind of a little hard-headed too, and she drove and came to the office, which was not very far off, only a couple minutes away, and she's crying very, very deeply, and she thought that
I know it's a tough journey for both of you, and I am so proud of you both coming out and sharing your personal story so that everybody out there can look for their health. Thank you, Dr. Sodhi, and thank you, Rekha ma'am. I'm so proud of you both.
That then I start thinking about that, why it happened to me, because I lost my son.
So she wants to get pregnant after we lost our second son, and so she was doing IVF.
I know, ma'am, denial was the first thing that hit you harder, but after denial, what was it? What were the thoughts that were coming to your mind?
So I start digging at myself too, that why it happened to me, because after eating such a clean diet and everything organic and everything too, and then why it happened to me. And then I find out, I was thinking, and then I find out that I lost my son 20 years ago.
In 2006.
2006. And he went to school, never came back.
16 years old.
Yeah, 16-year-old. And then after that, in 5.5 months after that, I lost my dad, losing my son. So it was like two main persons in my life. The man who gave me the birth, and the boy I gave the birth. So it was too hard for me. I was so stressed and so depressed, and why me? Shattered. And why me? I was asking God every day, why me? Why they choose me to do that too? So it was, I didn't get any answer. So I was like, I want to get back to my son so badly that I said I went for IVF.
The stress,
The
the
stress,
the fear of losing your son,
Oh, yeah,
and
yeah.
everything,
Yeah,
that
she was so
emptiness.
desperate to get Rishi back. That's what she was trying to say. I want my Rishi back. I want my Rishi back.
I think
And this is the biggest curse any parents go through, that losing a child was the biggest curse any parents can go through. I was like, my God, do I want to live or not? Because he was a part of my life. He was a part of my body.
this is such an emotional story, ma'am, and a tough one. I'm sure it would have been a hell of a time for both of you when you were going through it and living it. It's truly a privilege and honor that you guys have come out and talking about it so bravely. I think people need to hear this story.
So interestingly, because I see a lot of cancer patients, trauma is one of the biggest thing in the life of a cancer patient. It can be a loss of a son, father, husband, or any dear one, or any traumatic thing must have happened in their life.
That stays in their
Stays
body.
there.
The trauma is something
Exactly.
that was in your body for
Body.
like so long, and you were dealing with it.
Yeah.
And you were just every day you were living that trauma.
There was not even a single moment, single day that I didn't miss myself. So
And you
I
were
was
just living.
living, yeah. For after he was gone, like after 5 years, when I was coming home, that baby, mama is here. So I was doing that too every day. So there is not even a single day that I don't remember. I don't miss him. This journey has been so tough for me because I never had a closure with my son, with my dad. Even last year I lost my mom. I never had a closure with my mom too. Today 8:30 I had an appointment with my oncologist. I'm wearing the sweater of which my mom made it by her hand, and this necklace my dad wore it when he died, and my son, his picture in always in my hand and in my purse too, in my brain too.
That is how you get the strength to talk about it,
Yeah,
to come
yeah,
out
yeah.
and face it every single day.
Every single day I feel like they are with me. They are my angel. So
The guardian angels, you always feel
yeah.
that they are with you.
And whenever I stuck in some, I had lot of stress, like with me, any day I go and talk to him, talk to my son, that I'm stuck here, can you help me? And he does help me.
I'm sure.
Yeah.
She never got the closure she wanted. How did you help her?
Yeah, losing Rishi was loss for both of us, and even for our son too, older son. And he went through a hell for 1 year. He was in second year of school, college, and he actually dropped down for 1 year completely. Could not handle it. And so we were worried. Now we lost one son, and now second one is really spinning. But I think through the sheer strength of staying together, we made life more ritualistic. We get together, we will breathe together, we'll do yoga together, we go for walk together, we will eat more healthy, we'll try to bring topics which were kind of laughing.
What was the role of a partner?
Yes,
Equal in
exactly.
every single thing. You guys exactly did that to get that
Exactly.
closure.
Yes, so that actually how we were able to beat. And then Guni, my first son, also graduated from Seattle U with in business degree and finance degree, and then he later on went in to do his MBA. So it came out very good. But the problem, I think, with the trauma is it stays with you, and you have to learn how to live with it. And so there is always an ache which will going to bother you and haunt you, but you also, I think, can enjoy and find a solace in the moment he was present with you, the number of years he spent with us, the 16 years he spent with us. So I feel that I was lucky to spend 16 years with him, and that's what I tell her too. That I think that's what we need to do, and find a joy in that 16 years of his life.
As you always say, that be in that moment,
Moment.
live that moment, the gratitude and everything.
What I realized, and I actually even wrote an article on this one too, that you're trading off. There are certain cancers which respond very well to chemo and radiation, but not every cancer respond very well to it. So it was a challenge for me, and because it was 2017, I have seen a lot of patients of breast cancer before, but it was not my wife. It was somebody else, and was more easy on me rather than having her. So it was more difficult being a physician and said, if I'm making a right choice for her.
I
And
think
it
her
was not-
husband in you
Exactly.
needs to take a back seat, and the
Exactly.
physician in you was at the forefront helping her.
Yeah, and actually, I was not making decision for her. I let her make decision because this is her decision, her body. I can love her to death, but I cannot suffer a single ounce of pain what she suffers. I cannot feel that pain which she goes through. So I was wholeheartedly supporting her. Whatever you say, I will do that, and I will try to do the best. I will try to see what is available. So I did a lot of research, and I did a fellowship in oncology. I also did another fellowship in oncology.
I think that's why cancer is so close to your heart. You
Yes,
are just
exactly.
right
That's
reading
right.
that.
I want to.
It's a personal thing.
Personal thing, yeah. It's actually I wanted to help people, and every day, my clinic we see so
You're
many.
just
patients.
giving back
Giving
to the
back.
society is what
Exactly,
your
yeah,
agenda
exactly.
is.
And it's not that whatever I do 100% is it cures every cancer out there. It's not that case, and I wish that was that easy, but it was especially very difficult when it comes to your wife. So, but I'm very glad that she didn't want to do it, and so I was supporting her. So we did all the therapies to support her immune system. We cleaned our diet, which we were already eating very clean. We cleaned complete, complete overhaul.
Let me ask Rekha ma'am now. Rekha ma'am, how was the journey of the diagnosis and then being in there on the journey of healing?
Because I have seen my husband like so devoted to the cancer patient. I was fully trusting him. Whatever he will ask me to do it, I will do it. Actually, they were not asking me to do chemo, but they were saying that to me to radiation. So, and then we question, can you give us like what kind of results are after the radiation too? So I didn't get
Solid answer.
Positive
solid-
answers
yeah,
from the.
solid answer. So I don't want to put any poison in my body. So
There was trauma and stress already there in your
Already
body,
there.
which you are dealing with, and something external was something that you were very clear, I do not want my body to
I
have.
don't want to do it. Yeah. So I choose not to do that. The radiation too.
Okay.
It was my decision.
But she was also advised aromatase inhibitors, which is estrogen blocker. Her cancer was estrogen and progesterone sensitive. So estrogen blockers, but when I did the research on it, so it did reduce your cancer reoccurrence, but people die prematurely with the heart disease. So overall, the length of lifespan does not increase. That's what I read when I did the research
So
on
there
it.
was the trade-off.
Trade-off.
Cancer or the heart disease.
Heart
That
disease.
is what you choose. You guys
Exactly.
had the option to do it.
Exactly.
The trade-off between the two.
Yeah, so I think one the best thing what I suggest to my patient is choose life. Choosing a life is a wonderful thing, and living every moment. Rather than okay, what will happen tomorrow? I don't know.
And as Ayurveda says,
Exactly.
it's like the whole person that is
Exactly.
treated in Ayurveda.
Exactly.
So we are just giving the
Yeah.
whole happiness to that
Yeah.
person here.
So we actually created a wonderful ritual in the evening before we sleep. We both thank each other.
Thank each
The
other.
gratitude journal kind of thing.
Exactly.
Okay.
Thank the universe, and we thank for everything. For
We
our
thank God for giving us another day.
exactly.
We thank each other that we are together. We thank God that our family and friends are okay. So
And we had amazing friends, for 1 year,
family and
every
friends.
every day.
That is very important part
Yeah,
of
Yeah,
the, I
yeah,
think, the
yeah,
recovery and the healing
exactly.
journey.
otherwise losing a son, we could have done like an antidepressant pills or anything that we didn't take
Took any
even
any those pills either.
any pills.
Yeah. So I think when the Rishi passed on, we have friends who will come to our home once a week and do the chanting in our home for 1 year, complete 1 year. So we are so thankful for those friends too.
Yeah,
So, ma'am, you chose surgery.
yeah.
So, how was the journey post that?
So I did the mastectomy and reconstructive on the same day. My surgery was like a 14-15 hours
Oh God, it's a big one.
from 6 o'clock in the morning to 10 o'clock at night. I was under anesthesia for that long, and that was the first surgery in Overlake Hospital, Bellevue.
With that kind of surgery.
That kind of surgery. So that long. It was like, yeah, so it was very tough surgery because it was all over. I had like, what was that?
Drains,
Drains
yeah,
all
a lot
over.
of drains which
For 1 month, I was not able to like
change sides.
change side. I have to sleep like on.
You were just lying down straight, you
Yeah,
couldn't move.
Yeah.
It was a tough one.
It
The
was-
major one and the tough one.
Yeah, it was a major one and it was very tough one too. But with the support of my husband, because he was giving me IVs and
So you were there with the treatment team,
Yeah.
not as a husband but as a physician, right
Yeah.
on her team, helping her recover.
yeah.
Okay.
So after that, then my energy, because he was giving me IVs twice or sometimes 3 times in a week too.
Oh.
Yeah. So that my energy level after 1 month, I was ready to go back to work. I went to work.
I think you had a wonderful support system in Dr.
Oh,
Sodhi.
yeah.
That
Actually,
just
I
helped
think
you heal.
one other thing is because the work was healing for her too, because she will listen to, because we see patients, and everybody has a story, and she will connect to them at that level.
So I think treatment and healing, two different things, and healing is what she
That's right.
chose
That's
after the surgery, the treatment
Exactly.
part.
Yeah. So because that talking to the patient, because everybody has a story of cancer or something, but that gave her a lot of
Hope, strength.
Yeah.
and strength.
I'm the only one who lose a child and had the cancer. And then I was talking to lots of, because when patient come to us in our office, they are not like a number. They become like a family member to us. We
I'm
just
sure.
help them, hug them, or
I know, I am your
Yeah.
patient, so
Yeah.
I know that what it means.
This is the fourth time she had that, and she came and she started crying. And I said, "What happened?" She said that I talked to my doctor, and because I was going through a lot of stress, and I said I want to smoke a cigarette, and then the doctor said, "It's your life, it's your body. Do whatever you want to do." And she said, "I don't want to listen that. I want somebody who can."
Support.
Yeah,
I think
empathetic,
everything that is what
And
when
empathetic too.
yeah,
Yeah.
empathetic. So I gave her a hug and she started crying and I started crying. So it was a beautiful moment. And she said that I feel like I'm like a family member here. I like somebody is, I can talk to anybody like my family member. I can talk to.
support is
Yeah.
what that you just
Yeah.
provided her,
Exactly.
and
Yeah.
that just
Just
gave her
hug.
the thing.
Yeah.
Giving her hug.
The
makes a
hope,
huge-
the sense of hope is amazing in medicine.
Doctor, I think the support and the empathy is what the
Exactly.
patient requires the
Exactly.
most, because you are already shattered, you're already going through a
Yeah.
lot.
Yeah.
And that hope, that hug, as it is rightly said in our movies, Jadoo Ki Jappi,
That's right. Yeah.
that just heals all
Yeah.
of us.
Exactly.
Did your relationship with your body change over the period of time?
Yes, I start taking care of myself
More.
more, and I start listening to myself, my body, because before that I was not listening to my body. Go,
She was give.
Give, give.
Yeah.
So you became the priority after the
Yeah,
treatment.
yeah,
So you
yeah.
were the priority. The center of your world was
Yeah.
Rekha now.
Yeah, and my husband supports me a lot too. Because
I'm sure.
whenever he's 2 times, then he start asking me, "Are you okay?
Are you
Are
okay?"
you okay?" So it's like
I think that is
he
what
is
makes
Yeah.
you guys a wonderful pair, the
Yeah.
partners in the real term.
Yeah, so
That is what a
he-
husband wife should be like.
Yeah, it's not like a hugging and kissing or this is we are married for 42 and a half years.
Oh, that's a long time.
Yeah, so we know each other very well too.
I know.
Because when I'm sick and when he is like down too, we boost each
Because
other.
I think you guys have been with each other for such a long time. The small gesture,
Yeah.
maybe body language is what now you both
Yeah,
understand
are you
for
okay?
each
Are you-
other.
Even at night too. If he wakes up at 2 o'clock, I'm a very light
Sleeper.
too. So when he wake up at 2 o'clock, are you okay? I'm just like, and if I wake up,
I think
and
that the losses has created a panic in her too. So she wants to reassure that everything is going fine.
yeah,
So being a doctor, I understand that, but it's like I think that the void in you is
I think it stays
continuous.
there.
Yeah.
It
The void
there.
stays there.
Stays
It
there,
won't be
yeah.
filled.
No,
I don't think it
until
won't be
I-
ever filled.
Yeah, it will never be filled until I die.
But you are
It's gonna
still,
be like that.
I mean, you are
Last
still
will-
living with it. That's amazing, Rekha
Yeah.
ma'am. That's really amazing.
Yeah.
Our strategy here was not fighting the body, but restore it, and body knows what to do next automatically. So we mainly focused on building her digestive system, cutting down the inflammation, building the immune system, and rebuilding inside out by calming down the stresses, yoga, meditation, breathing exercises, and then rest become a history. It's been more than 9 years. She's cancer free and knock wood, and hope many years to go.
Rekha ma'am, what would be your message to the women listening out there?
I just want to tell them that try to take care of them too. Don't avoid, listen to your body and live in the moment. Don't postpone your screening. And if you feel like some fatigue or anything, just listen to your body. You are the engine of the family. Lady can do anything. And if an engine is failed, then the whole family shattered. So this is the message, and live in the moment too. And never send a negative message to your brain. This is the powerful tool too. So always send a positive message that you are going to be okay if you got diagnosed too, and always send that. You are gonna be
Positive
okay.
affirmations, Rekha ma'am.
Because brain makes a, like whatever you send to your brain makes the same thing in your body too.
It makes believe you that whatever positive affirmation you are doing, that
Yeah.
your body starts believing that
You are actually programming your system by
correctly.
doing the right thing.
Okay. So I think it would be my joint question to both of you. After whatever you have experienced, lived, what does health mean to you, both of you now? I think as a couple, can you both tell about that?
Yeah, I think health is the main. If you have less money, it's okay. But if you have less health, that's not okay. Because you cannot buy health with the money. So taking care of yourself is the main thing. And we are neglecting ourselves, but we should not prioritize your health and doing the good things too.
The positive affirmations, I think you correctly said that.
Yeah.
What's your take?
So basically, I think again, same simple thing. Body knows how to heal. Everything heals. You make a cut, 7 days later, cut is healed. You break your bone, 6 weeks later, your bones are healed. But you need a routine. You need to eat right. You need to do breathing exercise. You need to calm down, have a good quality sleep, and enjoy the moment. Your moment is very short. It's already gone, become a past. And like as a partner, enjoy each other's company. This is short lived. It's nothing. We're not here forever. So I think in understanding the short living of the things, and enjoy that the special moment which we have been given is very important, and we should enjoy that.
I want to add on to it here. I think Sonu Nigam ka song I want to add here. हर पल यहाँ जी भर जियो,
Yeah.
क्या हो समा कल हो ना
Kal
हो.
na ho na ho.
I think that
Exactly.
was the crux of it.
Yes.
And I just want to tell everybody that if you love somebody, just go and tell them. You don't have to wait for when they die, you have to tell them. So, right now, today, do it right now. Because when they are gone, they are not going to be able to listen to that. Just live in the moment and
express
Keep loving
love.
your family,
Yeah,
express it. I
exactly.
think.
express it. Expression is very important.
Thank you both for sharing such a personal story with our audience. And thank you everyone for listening to this.
We hope that this conversation reminds you that awareness, compassion, and early listening can change the way we experience health. We will see you next time on the Disease Free Society podcast. Don't forget to like, share, and subscribe. Thank you.